Back pain is the commonest affliction of mankind. After hypertension, if there's anything, and headaches, if there's anything that afflicts a mankind, it is the back pain. The reason being that we are basically animals of four legs who have stood up. So the architecture of our spine has always been for four legs. And that architecture is an S shape, which has fulcrums at lumbosacral junction, which is where our waist is, and at the cervico-dorsal junction, which is where our shoulders meet the neck. So these are the 2 points where we maximally get aches and pains. On top of it, we have become sedentary, which means that we are sitting most of the time, and sitting causes 3 times more exertions on the cervico-dorsal region as well as the lumbosacral region. So slip discs of the neck and the slip discs of the lower back have become very common afflictions. 99% of the time, these afflictions are non-sinister, which means they are self-limiting and can get better with simple measures that we can take care of ourselves at home or with the help of the physiotherapists. Only in less than 1% of cases do we actually require to do a surgery for these cases. It is important, however, to prevent them as much as possible. Good sitting habits, good working habits, ergonomic chairs, ergonomic workstations are an essentiality of these days. It is important that we put our laptops in a manner that we use it lower to our body so that it is not causing us more exertion to our shoulders and to our elbows and to our wrists, as well as to our necks and eyes. Similarly, when we are exercising, particularly in the gym, when we go onto that treadmill, there's a high chance of causing a back injury because we are not holding to the side railings or the front railing while doing our treadmill exercises. The moment we bend forward, the time for injury happens. So where do we as spine surgeons and spine doctors come to help you? We help you by reducing inflammation in these backs. We help you by putting you into an exercise program, by doing investigations like MRIs and CTs, also checking for bone health. Low vitamin D, which is a very common affliction of Southeast Asian society, is also responsible for causing weakness in the muscles of the back, hence causing back pains and neck pains. So we check those and we correct those for you, and we advise you to go back to a healthy living, healthy lifestyle with regular physical exercises. Very rarely do we advise you for any injections in your back or for surgeries of your back. If the need be, these are also very safe and it can be done very easily, and the patients can be up and about and back to their work within 4 to 6 weeks of time. The aim of this talk is to tell you that most of our back pains are non-sinister, so we should not get too worried about them. At the same time, it is important that we go to our consultants, we go to our doctors and show it to them once so that simple things can be corrected very easily and we can get back into our lives normally.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.